Hello and welcome to Medical Made Easy. Today we are discussing Palmetto, enlarged prostate, prostatitis, and prostate cancer. If you still haven't subscribed to our channel, you may do so because we are discussing some frequently asked questions in the end of this video. So you may also watch this video till the end. So let's get started. Palmetto, with its roots deep in history, has been a trusted companion in the realm of natural remedies. The Native Americans and early settlers in North America turned to this botanical gem to address a myriad of urinary problems, including those associated with male prostate health. In the archives of American Journal of Pharmacy from 1879, Palmetto emerges as a historical medication with a rich legacy. The 1920s marked a turning point as the pharmaceutical industry surged in North America and Canada. Clinical trials became the norm, and physicians, once proponents of medicinal plants like Palmetto, transitioned to prescribing pharmaceutical pills. This shift led to a decline in the use of supplemental in North America. Paradoxically, during the same era, Palmetto found itself on the rise in Europe, embraced for its potential in treating various health issues. Forms of Palmetto: cranberry versus liposteroidal extracts. Understanding the two primary forms of Palmetto is crucial. The common variant found in drugstores is essentially cranberry powder sourced from the American dwarf fan palm tree. This variant, while widely used, lacks the richness of fatty acids. On the other hand, liposteroidal supplemental extracts available in forms like hexane, CO2, or ethanol extraction are enriched with these essential fatty acids critical for influencing prostate health. Fatty acids as prostate protectors. The magic of Palmetto lies in its fatty acids, which, when absorbed into prostate cells, trigger mechanisms like inhibiting 5-alpha reductase and reducing the production of inflammatory mediators. In vitro studies expand the narrative, indicating additional benefits such as inhibiting muscarinic and alpha-adrenergic receptors and displaying anti-tumorigenic qualities. North America versus Europe. A striking dichotomy exists in the guidelines regarding Palmetto usage. While North American guidelines advise against recommending Palmetto to patients, millions are spent on it despite this caution. In contrast, European guidelines rooted in long-standing use and experimental trials recommend Palmetto for lower urinary tract symptoms secondary to benign prostatic hyperplasia (BPH). Symptom improvement insights from over 60 clinical studies. The crux of this matter lies in a comprehensive review of over 60 clinical studies. Despite the challenges posed by language disparities, a compendium of research studies has been collated. Within this body of evidence, Palmetto supplemental extracts emerge as more than just a trend, showing substantial symptom improvement, enhanced quality of life, and notable effects on maximum urinary flow. Navigating the trials. The journey through clinical trials unveils a complex tapestry. North American trials, such as the STEP trial and the CHEMOS trial yielded negative results using a carbon dioxide extraction type of saw palmetto, no longer available. In Europe, a different story unfolds, with hexane-extracted supplemental extracts proving effective in multiple randomized placebo-controlled trials. This inclusive nature of these trials underscores the complexity of the saw palmetto narrative. Prostatitis, a battle against inflammation, turning into attention to prostatitis, a prevalent condition affecting 3% of men annually. Saw palmetto emerges as a potential ally. Chronic prostate inflammation, a predictor of symptom progression, finds potential relief in saw palmetto, particularly through hexane extraction. However, the jury is still out, as systemic reviews and meta-analysis seek solid evidence from randomized placebo-controlled trials. Hope on the horizon, saw palmetto in chronic non-bacterial prostatitis. A glimmer of hope emerges in the realm of chronic non-bacterial prostatitis. Recent trials, such as the one conducted on saw palmetto extract in chronic pelvic pain syndrome, show promising clinical responses. The safety, efficacy, and superiority to placebo open new avenues for those seeking alternatives in managing this challenging condition. Prostate cancer, saw palmetto's potential role. As we delve into the complex world of prostate cancer, saw palmetto emerges as an ideal candidate for prevention and management. Its multifaceted actions, including inhibiting 5-alpha reductase anti-inflammatory properties and influencing apoptosis, position it as a promising contender. However, the lack of substantial evidence in preventative trials and the natural stance in large-scale studies challenge its definitive role. A call for precision. Recommendations for saw palmetto use. In the landscape of supplemental extracts for prostate disease, saw palmetto stands out as a valuable alternative for men dealing with mild to moderate conditions. The avoidance of pharmacological routes and surgery, coupled with its safety profile, makes it an effective option. However, the recommendation comes with a caveat: opt for a liposteroidal extract, preferably the CO2 variant supported by USP approval. In conclusion, saw palmetto's journey is a tapestry woven with historical significance, diverse forms, and conflicting guidelines. Its efficacy in symptom improvement, particularly in BPH, is supported by a robust body of evidence. Prostatitis and prostate cancer, while showing promise, necessitate a cautious approach as we navigate the complex landscape of saw palmetto. Its role in prostate health unfolds as a story in progress. Now, as promised, we have come towards the end of this video, and if you're still watching this video, you may subscribe to my channel, because on this channel you will receive regular updates regarding BPH. You may also share this video with your loved ones. So let's begin our frequently asked questions. Number 1. Is saw palmetto safe for long-term use? While evidence suggests the safety of saw palmetto extracts, consulting with a healthcare professional before prolonged use is recommended, considering individual health conditions. Number 2. Can saw palmetto prevent prostate cancer? Current evidence does not conclusively support saw palmetto's role in preventing prostate cancer. Individuals concerned about prostate health should adopt a comprehensive approach, including regular screenings. Number 3. How do European and North American guidelines differ? European guidelines recommend saw palmetto for BPH-related lower urinary tract symptoms based on long-standing use and positive trials. In North America, caution is advised due to conflicting trial outcomes. Number 4. What is the recommended form of saw palmetto? Liposteroidal extracts, especially CO2 extracts, are recommended over common ground berry powder for optimal effectiveness in addressing BPH symptoms. Number 5. Where can I access quality saw palmetto supplements? Quality matters. Ensure that any saw palmetto supplement chosen is a liposteroidal extract, preferably CO2 extracted, and adheres to relevant quality standards. That's all for today's video. I hope you liked this video, and if you found it valuable, you can share it with your loved ones. Until next time, bye-bye.